This is the organization very similar to HIMSS. It's called the American College of Healthcare Executives. And it's good for you to be not only a member of HIMSS, but of this organization to find out where the job opportunities are and how to plot your future. So I'll just show you a few things. Can we get the next slide, please? Okay, anyway, what we do in our program is once a year we compete with all these schools plus other ones in the Western United States to find out who can propose the best solutions to management and financial problems in large healthcare organizations. And so this is the College Bowl, and point I want to make in all of this is that everybody had a cost dilemma, and what I'm trying to recommend is for you to focus on the financial aspects of what you're doing in your organization. It will help you kind of move your way to the top. So if you can have the next slide, please. This is our winning team from this year, and they're all Cal State LA students plus a couple of faculty. We won first prize. This is the last year's team. We won third prize. And as you go through every year, you will see the teams of members meeting right here, winning these various awards. And this is the Healthcare Policy Council. Once you join, you meet them. They do in charge of all the hiring. Here we have industry speakers and full support from the industry, just like HIMSS. Anyway, once you get involved with this as a student member for only $35 a year, you get access to everything. We have Saturday tours of hospitals. We have tremendous conventions with industry professionals, and in the process, you'll be helping them solve problems and learning how to integrate yourself into the industry. Because these people all have big organizations, and they're always looking for people to hire, and they will be looking for somebody like you. Now, at this point, they don't know you, and you don't know them, but by joining, you'll get ready access to them. And my point is the way I got ahead in all of my career moves was by such things. Somebody would recommend me here, there's a job opening there, there's one over there, call this one, call that one, and I would get calls, and next thing you know, I'm starting to move, which I kind of had nothing to do with. It just kind of happened, and it's all related to joining HIMSS, ACHE, et cetera. If we could have maybe a couple more slides here, you can see, I won't go through all the stuff. All this stuff has to do with costs and increasing revenue, decreasing costs, and so forth. And all of the stuff on these slides will be available to you after the event, because I'm told that these presentations will be available for those who are interested. So maybe just a couple of more slides before I turn over to another speaker. You can see we use Six Sigma analysis, all kinds of policy development tools, setting up electronic health records, and so many things needing so many specialists in so many areas that without such an organization, you won't really be able to cope. I mean, here you'll know the specialists who can help you solve problems in a jiffy. So maybe a couple more slides and we can go over to the next speaker. So anyway, these are ways of reducing costs and increasing revenue and all kinds of things, retrenchment, and at the end, becoming a healthcare manager, enjoying life. Kind of what I'm saying, I think the last slide, it shows an article I wrote and published in the magazine of American Mensa, and local things, encouraging them to do exactly the same thing. Get involved in such organizations as HIMSS, ACHE, learn how to control costs, and you will find your way to the top right away. Thank you, and I would like to turn it over to the next speaker. Okay, thank you, sir. Okay.
Hey, Barry, how is it that you're able to look so young as the years, all the way back? Photoshop. No.
Well, just on that point, I'm a very local person. I was born like 1 mile from here. My whole career has been in this area. And all the people that hired me like 40 years ago, they're all still around. And we have monthly meetings. We meet at the San Antonio Winery, and these old timers keep inspiring me to do the best and find out where the opportunities are. And I've tried to get you guys involved in the same process. Thank you.
Thank you, Barry. That was great. It's always been a joy working with Barry. So I'm Jonathan One, and I lots of experience in the LA County universe, and I joined my colleagues Barry and Jim Brady there. I also work at UCLA. I teach the project management and risk course over there. So I brought in some slides that I thought, you know, little snippets of what I do over there to kind of give you the overall feel of my very diverse kind of background. Never thought I'd land in the area I'm in right now today, and it's probably because so much has changed in the landscape over the last 20 plus years. I've always been a part of IT, and healthcare has been dear to me. I have this trick leg, so you might see me limp a little or go back to my seat. But you know, I figured let's take a look at some of the things in healthcare, automation, IT, and project management and risk that I kind of deal with. A lot of you have probably seen this cartoon, right? Very popular out there, this cartoon strip about communication and project management. It's commonly said, yeah, what did the customer ask for? What did the customer really want that they didn't tell us what they were asking for? And so it's interesting. This has become quite popular, and it's been around since the late 60s, 70s, across the pond from Britain over to us here. And so basically it says, you know, how did the customer explain it? How did the project leader understand it in the next one? Then the engineer designed it in a certain way. And then you go through all these iterations to finally all the customer needed was a simple rope, a tire, and it swings from a branch, and they have a wonderful product. So what is a project? Yeah, we hear a lot of people talk about projects. Everything seems to be a project nowadays, and maybe it's a little overused. Really, a project should be something temporary, right? There's like a begin and end date, something unique comes about from it. And so we're doing a lot of unique things, and there's a lot of time-sensitive things we do with projects, but also for tasks. And so there's different methodologies that have come up over the years to kind of do that. I wanted to share a quote from our wonderful president in the past. There are risks and costs to action, but they are far less than the long-range risk of comfortable inaction. And I thought that resonated because, you know, there's things we got to do with our projects, the different healthcare things we want to improve, the automation that we want to apply into our settings to help us improve all those business processes and projects. And so that was in response to the Cuban Missile Crisis. We have a lot of burning fires at all times, and I thought that might resonate. Even to today with, if we go back one, with Facebook, right? We have all this talk about what's going on with fake news, and you know, there are projects at Facebook to try to figure out how to deal with the fake news, how to deal with the things such as the biggest risk is not taking any risk. In a world that's changing really quickly, the only strategy that is guaranteed to fail is not taking risks. So how I look at risk and how this has come into my world and my career is that a risk is a mindset, right? We think about projects, we think about tasks and deliverables and management, but really we're looking at risks. That is the common theme throughout all of it. So if we're looking at our return on investment, our payback, we're looking at what's the risk, both positive and negative, that we need to balance in order to improve something, right? So then we move on to, you know, what is project risk? We're looking at these different elements of threats and opportunities. Doing a balancing act is really what we're talking about. And so on to our next one, I wanted to share something real quick. So when I talk about projects and risks, there's a methodology, and I won't bore you too much with all of that, right? You have your wonderful kind of the breakfast snacks that were provided. We have a lot of great topics that our panelists will talk about. I'll speed up through my part. There's a whole methodology behind it, but using these concrete methodologies, the project management world is really part art, part science, kind of like the world we're in healthcare IT. Part of it is the concrete deliverables that we do provide, but then there's that art of how do we get there? How do we make things happen even though there's no single path to that final outcome? So project management, the whole risk universe, kind of involves that, right? There's many different ways to skin a cat. And so we can identify risk, analyze it, and then go through these loops like the PDCA cycle, right? Plan, Do, Check, Act. We're all familiar with everything that goes in the circle of life, and there's all these different models. I wanted to kind of get to my ending slide here is talking a little bit about the county where I spend a lot of my time outside of UCLA. If we look at this quick snapshot, right, some of the county budget here from a couple of years back, if we looked at the top big expenditures that we pay for here in the county, We can see public social services, sheriff, mental health, children and family services. Those top four all have healthcare needs. I mean, if we looked at social services, there's working with CAHIMS and Medicare and Medi-Cal programs to get people enrolled in that. Big chunk of expenditures there. Sheriff's Department, right? In the jail system, people get injured, get hurt. People in being, even when they're being checked in, they may be already hurt due to some situation where people who were arrested or whatnot were taken in. So mental health, children and family services, the same thing. So you see a theme of healthcare, right? And a lot of the requirements for healthcare now require automation. So I just wanted to kind of leave you with that thought. The figures down below, $4 billion in social services, almost roughly $4 billion in health services, and they've all increased since the couple years past. These are multi-billion-dollar entities that are working with you to help to improve things. And so if we think about it, this is a very big chunk and a very diverse group of people. So I'm really glad to be part of our diverse panel here. I'll turn it over to our next speaker. Thank you.
Good morning, everyone. My name is Danica Ramos-Lio. I'm an IT consultant at Kaiser Permanente. So how I came about HIMSS was when I was a student about 3 years ago. I was in grad school at National University. I was getting my master's in health informatics. I came from a public health background working at UCLA and Planned Parenthood. And after that, I grew an interest with electronic health records and looked into what career path I can go in with healthcare and with information technology as the millennial that I am. So I stumbled upon health IT or health informatics. And as I was in school, I met a professor who introduced me to HIMSS. And from there, I joined HIMSS and I went to their conference as a program assistant in 2016 in Las Vegas. And I met with my local chapter here in Southern California HIMSS and met great colleagues such as Sunny, who introduced me to volunteering with HIMSS, and Jerry Pavia. So from there, I became the speaker liaison. So for a couple of years, I've been helping out the chapter with conferences such as these and networking with peers such as you to put together these events. So a little bit about me. After I graduated at National University, I became an intern at Kaiser in Orange County, and where I met Jim. And from there, and Vicky over there, and from there, you know, becoming from a student to an intern and now to an IT consultant, I've just grew a lot from the network and the peers that I've created and made here on this platform. And during my journey, I tackled my CAHIMS certification, which is an entry-level health information management systems certification, which helped me a lot because even though with my degree and with my public health background, I needed to know more about the whole health IT information systems infrastructure, especially in my role today working in a hospital. I don't have much of a technical background. However, I wanted to learn more and to stay current with my peers. So obtaining the CAHIMS certification helped me learn and expand my knowledge within the industry.
Thank you very much for that. And yes, let's clap for her. So one other follow-up quick question for you. You mentioned volunteering at HIMSS early on, and my theme, of course, is volunteerism and how that can help with career progression or career knowledge. So can you give a little bit of a background on maybe how HIMSS, volunteering at HIMSS and what you've done has helped you to transition into your current role?
So with volunteering with HIMSS, not only did I network with other professionals, but I got to meet an array of professionals in the industry, you know, from CIOs to other analysts, from those who work in networking, network infrastructure, privacy and security. So learning a little bit about each topic within health IT from everyone that I meet in, within HIMSS and volunteering with HIMSS have helped me gain insight within my role, that if I didn't know anything, if I didn't know how to work on a project because I don't have much knowledge, whether it's telehealth or interoperability or EHRs, I then know, hey, I have a peer, I have a colleague who's within HIMSS, who work in this industry or who works for this company. Maybe I could use their knowledge or pick their brains on how can I deliver this project well, and how can I engage them.
Thank you very much for that. Thank you. Moving on to Jim. Hello.
Hi.
Jim, can you tell us a little bit about your thought process in creating the Academic Alliance and what your thought was?
Okay. Yeah, so I've been involved with HIMSS for about 10 years, and just a little bit of background to kind of what got me into HIMSS, and then into what we call the AAC, unless we change the acronym. And by the way, they have me listed as the father of the AAC. Like, I must be seriously old here. I consider myself a young guy, but I had actually another career before healthcare. I was a youth pastor. I ran the office for Christian ministry in South Central Los Angeles for like 15 years. So I kind of did that. I love working with college students. So I've always been a little bit energetic. And, so young people have always seemed to have like a little connection. So I ended up making a transition, and I landed in healthcare, which was my job at Cedars-Sinai Medical Center, and I really resonated with, the whole theme in healthcare of helping people and making a difference, rather than, you come to work every day and your job is to cut people's credit off and, send them to jail or what have you. So some jobs, have a meaning, and, you can kind of see it, and so you can really get pumped up when you get up in the morning. Other jobs, like, you're not really excited about what you're doing, but you got to get a paycheck. So anyway, I ended up leveraging free IT training through Microsoft textbooks and stuff like that. So I became really good at Cisco and Microsoft, pretty much on the IT infrastructure side. But I used that. I got a job as a network engineer. Then I ended up doing kind of running all the email servers at Cedars. So, I realized that, hey, I need to just know more about. I wanted to grow in the career and kind of move forward and have a bigger impact and things like that. So, so I realized, how do I understand what doctors and nurses? Because if you don't understand the people that you ultimately are serving, which are patients, but we need our clinicians. And later on, we'll hear about on the payer side, we need to, be able to collect the finances in order to have things run. I needed to know more about just the industry, so I stumbled upon HIMSS, and so about 10 years ago, so I got involved, and they had an initiative. They had just won an award, which was they won the National Innovation Award, Southern California chapter, for this thing called the Academic Alliance, which was based on, let's go into places like where Barry works, Cal State LA, and others, and let's offer mentorships, internships, and scholarships. And so HIMSS, the national organization, said, that is awesome. Let's give this chapter an award. Okay, so there wasn't any actual operational, it was just a concept. So I got involved with HIMSS, and of course, as Danica was saying, you can come and you can listen to stuff, and it's very educational. But a really helpful thing is just join a work group, join a committee, rub shoulders with other people that are in healthcare, that are maybe managing, that are influential. Because if you want to get a job somewhere, so you want to get a job at Children's of LA Hospital. Well, wouldn't it be awesome if somebody on your, maybe the membership committee or the sponsorship committee, wouldn't it be cool if they actually worked there and they knew they could get the hiring manager to look at your resume? So it's getting these inside tracks in a lot of these places, particularly in healthcare IT, because there's a lot of opportunity in healthcare. It's an interesting field, but it is hard getting a job. It's hard getting a job, period, but it's definitely hard getting a job. in healthcare, and especially if you have to have Cerner or Epic training. How do you get that? You can't do that unless you're already in the organization. They send you to get training, so it's a little challenging. So I got involved and I joined a committee, and I said, oh, that looks like a cool committee, Academic Alliance, so I went to join that. And then I realized, okay, this is a good concept, but it didn't seem like it was going anywhere. So I just kind of did a gap analysis. I talked to other HIMSS chapters. I said, if we were just a soar as high as we can go, where could this go? And so I realized that there's a lot of excited students out there, but the mindset at the time was, let's talk to faculty. And of course, I'm a faculty at National University, and there's Linda, a chair of the department over there. So it's nothing to do with faculty, but I realized that the excitement and the passion, if I was able to get the students pumped up and engaged, then I wouldn't really need to try to go after busy faculty that are doing what I'm doing right now. I'm sure that Linda and Barry are doing grading papers and stuff like that. You don't have any time for this stuff. So I had this idea of why don't we try to operationalize and use a little innovation, the mentorship, scholarships, and internships. And let's go to the student groups at all the college campuses, talk with them, and see if they're interested. So it turned out that they all got excited, they were all interested, they all invited me and whoever came with me to to their various student health groups. And so we ended up getting this really large cohort of students, so that the Southern California chapter of HIMSS was just like blowing out the rest of the nation when it came to student interactions. So anyway, I think I just wanted to share that. And so since then, it has moved into the sustainable period. So we have different people chairing it, and folks are still going out to college campuses, talking with students, because the life of a student is only, 2 to 4 years, and then they're gone. Professors, they hang around a little longer. So anyway, and we also did reach out afterwards to the faculty and got them engaged also. So I think my experience was, this all just helped me to just get engaged in healthcare in a way that I wouldn't have done that. I wouldn't have had that experience if I stayed in my cubicle in the data center, looking at blinking blue lights. And I would never understand what a doctor or nurse has to do on the front lines if I hadn't gotten involved in HIMSS, and that helped me give me that opportunity. So that's just a little bit about the Academic Alliance and Jim Brady.
Excellent.
The father.
Thank you, Jim, and thank you for taking ownership of it.
I'm going to tell you a little bit about, in the second slide, what precision medicine is. And it's an initiative from the National Institute of Health. Their title for the Precision Medicine Initiative is All of Us. And it means highly precise care, highly individualized care that is based on the data from where you live, work, and play. And that phrase from the NIH, data from where you live, work, and play, means that we have previously given lip service to individualized care. Nurses are great for saying we're going to individualize care for the patient. Whereas medical treatment, as some of us know, really, if you fit into a category or a cubbyhole for dosage of a medication or a precision, rather imprecise treatment regimen for diabetes, for heart failure, that's where your treatment regimen comes from. What we're going to find in precision medicine is that people want to be treated as individuals, and with the advent of machine learning and artificial intelligence and data that from the electronic health record that is basically falling off the shelves, we are going to be able to treat each individual as a highly individualized treatment plan. Let me see if I can advance the slide. All right, so what is precision medicine? If you go to that website, and I want to pitch the NIH website and also the website from the American Association of Colleges of Nursing, there's a list of frequently asked questions that explain what it is. Let me say before I forget that the All of Us initiative, the name for precision medicine from NIH, means that the NIH would like to capture the healthcare data and enroll all of the, about 1 million plus people is the goal for the All of Us initiative. Enroll them in an electronic medical record and do a lot of surveys and eventually health histories and blood and urine samples if you are chosen to be an enrollee in the study. But I've enrolled to be an official enrollee in the study, and at that website for the frequently asked questions, you'll find a way to enroll if it so interests you. If I say we're only at the awareness raising phase, that means there's a lot of original research still ahead of us to be done and funded. And so right now, what I'm looking at on the screen is an initiative between the AACN, American Association, Colleges of Nursing, and the NIH to raise awareness about precision medicine. And what I did, going back one, is that I wrote a grant, we received at Cal State San Bernardino, a mini grant for the social media campaign to do just that, raise awareness of precision medicine. The way we did that is that a speaker came from Washington, D.C., from the AACN, and the title of the event was the title of my slides. So this is precision medicine. And the very first thing you do when you do a social media campaign, and my training is from the Claremont College and also from UC Davis, where my certificate in health informatics is from. And I am not a great big fan of social media, but guess what? I had to make peace with it. And the very first thing you do is get a dedicated Facebook page. It's not that much fun, but you know, someone has to do it. A dedicated Facebook page. And when I say social media campaign, you know, we did the best we could the first time out. And what it means is this isn't I'm on Facebook, it rained today. This is a comprehensive approach to an aim that you have. And the aim was to raise awareness and get people in the door in an event like this, face-to-face, January 16th, 2019 at Cal State San Bernardino. And didn't you know it rained 10 tons that day and really hurt our physical attendance. But the good news was that with Facebook, with flyers, both electronic and paper flyers, and with what I'm trying to show you here is a business card with the brandable images from, see all of us in the corner of that business card and those three nice looking young people. The other side of the business card that I passed out to everyone I found was the name, date, and time of the event. So this is precision medicine, and we basically hounded all relatives and friends we can find. Our attendance that day was going to be 350, and we had to settle because of rain for 250 face-to-face attendees at Cal State San Bernardino in 2 campuses, and another 150 people on Facebook Live. I'm acutely aware you can pack in 10,000 people for the fights, for wrestling, for a sports event, for, I don't know, tractor pulls. I really don't know a lot about that. But I know there were 150 willing participants on Facebook Live that we would not have had if I didn't write for a social media campaign. We would have had just the 250 local yokel, when in fact we had another 150 people from all across the nation. It was nurses, it was physicians, it was mostly nursing, it was faculty, students, and staff of the CSUSB. And right here on the screen is the name for our speaker, Dr. Colleen Linares, who came and spoke to us about what precision medicine is and isn't. And while I'm at it, what it isn't, precision medicine, it isn't just the omics studies. So it isn't just economics of healthcare. It isn't just genomics. It's all those things and more. All the data, including a wearable that you may have, will someday be reflected in your electronic health record. The data from where? From where you live, work, and play. So Dr. Linares started us off with some thoughts on what the costs of imprecise medicine are. Healthcare is targeted to the individual, average individual in a group, not the individual that you uniquely are. Healthcare problems can take years to unravel with significant trial and error in medicine. And as a nurse, I can say we've given lip service to individualized care, and a lot of it has instead been trial and error. There are other costs to imprecise care. Providers don't have enough research to draw on. Medical records are scattered. My doctor on Foothill Boulevard in Upland is a wonderful guy, one of the best clinicians you know, still using a lot of paper. So you have to ask yourself from the NIH perspective when Dr. Lawrence spoke to us, what's in it for the transformational approach to diversity, to participation, data access. Diversity, we mean the NIH is after everybody representative of who lives in America, not citizens, because that kind of implies something with legal and work and so on status. Everybody lives here. So someone from the South may use the term y'all. They also use in the South the term all y'all. So what the NIH really wants isn't just y'all. They want all y'all, including the people in this room who are sick, well, tall, fat, short or thin, old or young, and so on and so forth, chronicity or young and have no health problems. They want all y'all reflected in the 1 million plus. I don't live, work for, or represent the NIH, but they are committed to diversity of participants because really we're treating the average white male in lots of diseases. They are committed to the participation of everybody, including every clinician out there, and that data access. Guess what? You're going to get your own data back, is what the speaker told us today. Manage that. This is the still picture, which if you get the slides later and do a pinch and zoom, I'm the exhausted one in the middle in the back. And this is our diversity of our students in nursing at Cal State San Bernardino. Here's the team. There's myself in the middle with not as good a hair day as I hope I have today. On my left, which is your right, is the Professor Angie Gagalang, Program Director, who helped me write the grant, and our department chair, Dr. Terry Birch. And so if I had more time, I would talk to you about what's in it for patients, return on investment, your own data. What's in it for providers? You get a chance to really contribute to fast-moving medicine and medical care that is very individualized. What's in it for researchers? Lots of data. If you are involved in evidence-based nursing, evidence-based medicine, evidence-based anything else, I'll talk to you on the break. The research data is going to be falling off the shelves. The minute I hear from NIH and AACN on how much is available to me as a researcher, that's a minute before I can tell you, because I won't give up until I understand how to access it all, and that's coming very, very, very soon to a theater near us. And then what's involved is survey modules, activities. Unfortunately, if you do get enrolled and get called in, I think it does involve, sadly, driving to San Diego right now for donation of specimens, not sure. And that's what's kind of involved. The future of healthcare, this is a brandable image from the NIH project, and I love that image. It's part of our promotional efforts for the social media campaign. And this is a pitch for artificial intelligence and precision medicine. You can't have one without the other. You can't have totally individualized care without precision medicine and forms of artificial intelligence. If you are a practitioner of business, so maybe you have an MBA, a generalist degree, master's degree in nursing or public health, those are masters, you're supposed to be a master of a domain. I would strongly encourage you to get a sideline in informatics and data analytics, because those really aren't enough to carry you through in the long term. And I just want to thank Professor Barry Hunt for getting me involved in HIMSS. Really, I can't thank you enough. That's all. Thank you.